In this video, we will go over the action, origin, and insertion of some of the thorax, abdomen, and back muscles. Starting with the first muscle, the pectoralis major muscle. It is the prime mover for arm flexion. It adducts and medially rotates the arm. It also pulls the chest upward during forced inspiration. The origin, which is the immovable attachment site, is the clavicle, the sternum, the cartilage of the first 6 or 7 ribs, and the aponeurosis of the external oblique muscle, which is one of the abdominal muscles. Whereas it is inserted, the insertion is the movable attachment site. It is inserted by a short tendon into the intertubercular sulcus of the humerus, which is the bone in the arm. Moving to the second muscle, which is the rectus abdominis muscle. The rectus abdominis muscle is one of the abdominal wall muscles. The action, it flexes and rotates the vertebral column. So we have 24 vertebra in the vertebral column. It increases the abdominal pressure, also fixes and depresses the ribs in the chest. It stabilizes the pelvis during walking, used in sit-ups and curls. The origin of the rectus abdominis muscle is the pubic crest and the symphysis, whereas it is inserted in the xiphoid process of the sternum and the costal cartilages of the ribs 5 through 7. So it is inserted in the inferior aspect of the thorax, and it originates from the inferior aspect of the abdomen. Moving to the external oblique muscle. This is the external oblique muscle right here. The action, it compresses the abdominal wall, flexes and rotates the vertebral column as well. It aids muscles of the back in trunk rotation and lateral flexion. The origin of the external oblique muscle is the anterior surface of the last 8 ribs. You can see all part of the external oblique muscle right here. This is the entire external oblique muscle. So the origin is the anterior surface of the last 8 ribs. It is inserted in the linea alba, this line right here, in the pubic crest and tubercle, and in the iliac crest on both sides. Moving to the trapezius muscle. The trapezius muscle is the muscle right here, one of the back muscles. We can see the superior fibers. These are the inferior fibers of the trapezius. The action, it extends the head, rises and rotates and retracts the scapula. Also, it stabilizes the scapula. The superior fibers, they elevate the scapula as if you're shrugging your shoulders. The inferior fibers, they pulls down the scapula. The origin of the trapezius muscle from the occipital bone, which is this bone right here, from the ligamentum nuchae, the spines of the 7 cervical vertebra and all the thoracic vertebra. It is inserted in the acromion process of the scapula and the spinous process of the scapula and the lateral third of the clavicle. That is the clavicle. The lateral third is this part right here where the trapezius is inserted. And this is the spinous process of the scapula. Moving to the supraspinatus muscle, which is one of the muscles of the back, the action, it initiates the abduction of the humerus. That's very important. It stabilizes the shoulder joint. Also, it is one of the rotator cuff muscles. The origin originates from the supraspinous fossa of the scapula, and it is inserted in the greater tubercle of the humerus, which is this bone right here. Moving to the infraspinatus muscle. The infraspinatus muscle, the action, lateral rotation of the humerus. It helps hold the head of the humerus in the glenoid cavity. So basically, it stabilizes the shoulder joint. Also, it is one of the rotator cuff muscles. The origin, the infraspinous fossa of the scapula, and also it is inserted in the greater tubercle of the humerus.